Lymphoma is one of the most common neoplasia in dogs, representing approximately 7 to 24% of all cancers diagnosed. It is characterized by monomorphic population of lymphocytes in cytology and histology. Because lymphoma is a hematopoietic tumor and systemic disease, chemotherapy is the most frequently used treatment for canine lymphoma. Doxirubicin is anthracycline antibiotics used as an anti-cancer agent for managing canine lymphoma. This presentation will evaluate the efficacy of doxorubicin and its clinical application. There have been many mechanisms of action proposed for doxorubicin. Doxorubicin intercalates DNA. It inhibits enzyme TOP2, which then prevents DNA transcription. It also inhibits DNA and RNA synthesis by forming and stabilizing the TOP2 doxorubicin DNA complex, and it generates free radicals. These mechanisms result in damaging DNA, leading to apoptosis and cell death. A recent study proposed that doxorubicin activates CREB3L1, a cellular transcription factor, as a membrane-bound precursor, which inhibits proliferation of cancer cells. Doxorubicin is given by intravenous infusion. Dosage for dog is 30 mg per square meter intravenous infusion for every 21 days for 5 treatments. Dogs weighing more than 15 kg should be dosed at 1 mg per kilogram. Extravasation at the injection site can cause local necrosis, and amputation may be required in extreme scenarios. Side effects include GI acute side effects such as anorexia, vomiting and diarrhea, cumulative dose-related cardiac damage leading to dysrhythmia and heart failure, myelosuppression which can lead to leukopenia, and alopecia is common in dogs that have continuously growing hair such as poodles, and hypersensitivity. Doxorubicin should not be used in animals with cardiomyopathy. The standard treatment for canine lymphoma is doxorubicin-based multi-agent protocols such as CHOP. CHOP consists of doxorubicin, cyclophosphamide, vincristine, and prednisone. For this protocol, median disease control is up to 9 months, and median survival is up to 13 months. A study showed overall remission rate was 94%. It was also identified that German Shepherds had worse survival compared to other breeds. CHOP protocol can be costly, and if not able to afford the cost, treatment with single-agent doxorubicin is another option. For this protocol, median disease control is up to 7 months, and median survival is 9 months. A study showed that there was no statistical difference in remission or survival time between dogs treated with CHOP and single-agent doxorubicin. However, overall remission rate for CHOP was 90%, where it was 74% for single-agent doxorubicin. The advantages of multi-agent protocols outweigh the single use of doxorubicin. Dogs with T-cell lymphoma had significantly lower response rate to single-agent doxorubicin protocol than dogs with B-cell lymphoma. While 86% of dogs with B-cell lymphoma had complete response, only 70% of dogs with T-cell lymphoma had complete response. However, another study suggested that 96% of dogs with T-cell lymphoma responded to CHOP chemotherapy, with the median overall survival time of 235 days. These studies suggest single-agent doxorubicin protocol may not be optimal for T-cell lymphoma treatment. Overall, doxorubicin is efficacious against management of canine lymphoma. Potential side effects need to be addressed to the clients, and the choice of single-agent doxorubicin may not be optimal for T-cell lymphoma. Further studies are needed, including mechanism of action about CREB3L1, whether it can be used as a biomarker to identify cancers that are likely to respond to doxorubicin.